Okay, mhm. So could you please first state your name and career?
Sure. My name is Dr. Marilyn James. I'm a family medicine physician, and I work in the outpatient family medicine world.
So what does an average day look like for you as a doctor?
An average day for me in the clinic is usually like an 8 to 5. I get to work at 8, and I usually quickly look at all the tasks that came in, any patient questions, results, and then I start seeing my patients. And we have a lunch break in between where we're usually doing charting, answering patient calls, and just preparing for the next day. And then I break my day into 2 half days, the morning half and the second half of the day. And after the second half of the day, after seeing patients, we are usually wrapping up for the day, meeting with the medical assistants to make a game plan for the next day. Like if we have procedures and things like that, we just make sure that we have everything that we need. And yeah, and then head home. And I usually try to exercise, go for a walk with my family or something like that. And just spend some relaxing time with my family in the evening. Usually would have something to read up on for the next day. Yeah, sometimes if I can cook, I try to squeeze in some cooking.
So, like doctors have different fields and specialties. So since you're a family doctor, how does like what you do with patients differ from other doctors?
So, being a family medicine doctor means having a very broad spectrum, right? So that's where you have to know a little bit of everything. We are mainly the doctors who patients see first before they go to specialists. So we try to read up on everything. We kind of keep our eyes open for different pathologies. And we're also in charge of preventive screening and preventive care. So for patients starting at certain ages, we have certain preventive measures we need to do. And if somebody needs something that is very focused, like let's say somebody comes with joint aches, as a family medicine physician, I have to keep all differentials in my mind. Is it musculoskeletal? Is it autoimmune? Um, what could it be from? It could be different things. Sometimes people could have the same presentation from different like reasons. Should I be sending them to an orthopedic doctor versus a rheumatologist? So we have to do the initial workup. So we are the first line. The patient comes through as a very good, thorough family medicine physician. We have to take charge of the patient's care and do our thorough workup before we send them off to anybody else. So going back to the example of joint pains, we try to understand, hey, is it unilateral, bilateral, meaning one side or both sides? When does it happen? Do you have family history of anything? Which joints does it affect? And if it is like small joints, let's say fingers, then we would order autoimmune labs and try to get a workup going, do some x-rays of the hand, get some workup going before we just send them off to the rheumatologist. And the specialists, of course, they're more focused in on that one thing that we have sent them for. So if I send them to a rheumatologist, they're not going to be talking to the patient about swelling in their legs, and any edema or any palpitations they're having and those kind of things, right? So as a family medicine doctor, you're kind of like their family member. You're bringing everything together and addressing everything, and it's a very powerful role, I feel like.
So what do you love most about your job?
Like I was saying before, being a family member almost of my patients, because it's a great privilege and honor. Patients do develop a very special bond with their family medicine doctor. I found that when I send my patients to specialists, sometimes the patients will tell the specialist, hold on a second, let me go talk to my primary care doctor and see what she thinks before I proceed with this medication or reclass for osteoporosis. And it makes me feel very honored, and it's such a privilege, really. I don't have a very big family in Florida. It's just me, my husband, my mother-in-law. And so I tell my family back in Chicago, guys, like my patients are my family here. It makes me feel like I belong, and I matter. So it really gives me a lot of meaning in my life and constantly keeps me on my toes, like to keep reading and learning for them.
Mm-hmm. So when did you decide to become a doctor?
That happened a long time ago. I was a kid. I was born in India, and so I was living with my grandparents. And my grandfather was a physician himself. He was a family medicine doctor. So he had a small clinic in our house, just like one room that was dedicated as his clinic. And I saw, just amazed how good he was. Like I saw how he treated people, notwithstanding how much money they had, who it was. Sometimes people, like people who just traveled from afar, would be visiting somebody, or just came to the bus station and they got into an accident or something, and they would just walk up into the clinic, and he doesn't even know them, but he never said no to anybody, right? And it really inspired me, the kind of person he was. And I was just like, I have to be like him, he's just a pure human being, and I aspire after him. He was a musician, and he was a talented artist, and he loved plants and animals and everything. And everything he did was just so good and pure. And I believe in something that's called dharma. Dharma is like, the meaning, your ultimate meaning in life. And so, starting from a small age, for me, that was to help and heal people. And I thought about going back to India for medical school, but then I'm like, hey, I came to America when I was a teenager, and I'm like, rather than just going to India for medical school straight from high school, I actually want to use college as a time to explore different options. Because I did want to be a doctor since I was young, but what if I wanted to be a social worker? That also helps to serve people. What if I wanted to be an optometrist, a health coach, a dietitian? So I actually decided to do undergrad and explore all my options. And then again, I came back to not just any physician, but a family medicine physician, because it encompasses everything that I wanted to do. There's just so much, like it's a very versatile field. Like you could make it what you want it to be.
Mm-hmm. And since you always wanted to be a doctor, and before you mentioned like you wanted to go to India and go to medical school, but in high school, did you do anything specific like activities or extracurriculars because you
Mhm.
wanted to be a doctor, so you wanted to explore the field?
I did. So in high school, I just really listened to what my passions were. So and mind you, I just came to America in high school. I was 14 and I came to America. So it was a very scary place for me straight off the boat. And I did not let that hold me back. I had the accent, everything you could imagine. So it was a very intimidating place for me. However, I always believed that if I just do what I felt was true to me without doubting myself too much, the right crowd will find me and the right people will come to me, and my intentions will manifest. So one of the things I really cared about was eating healthy and addressing this epidemic of obesity. Many of my colleagues, I'm saying many of my classmates back then were becoming, diabetics and having many health issues. And there was just so much going on with needing to bring health and wellness. So I actually started a health and wellness club in 10th grade with my friend, and we brought a lot of awareness. We did a lot of activities to bring our friends and the other classmates together. We made it like almost like be normalized having fruits and vegetables rather than always having to grab the fries and the pizza. At that time the options in the cafeteria was limited. So addressing all of those things, it really was like such an inspiration for me then. So it started coming out of me, and then I made a club and many people were interested, and we would just bring in people to talk about their questions, their insecurities, their fears. So that way they're just not like walking with these questions alone, feeling insecure, too scared to talk about it. And so we brought all of that out. We would try to understand, hey, what kind of activities interest you guys? Because like gym can be boring. So what other things do you like? So we started doing kickboxing and yoga and fun stuff like that. We would bring in other fitness coaches from outside and do exercises together. So it made, exercise and fitness and starting to question the norm in the cafeteria, the norm in like eating fast food and all of those things. We started to instill that idea. We have to question it because our health matters, and something's definitely not right if we're starting to have sickness at such a young age.
Mm-hmm. Also, regarding college, you mentioned how you were like exploring different career paths and so I was just wondering, what did you major in college?
In college, I majored in biology just for convenience because I was in the pre-med track. So many of the things fell together. And so I was like, I also wanted to stand out and explore my other interests and passions. So I really had a lot of interest in psychology, and I minored in psychology, and it really added value to the kind of physician I became in the future too. And I also minored in music, which was the very deviant, far-fetched idea that I had. But I played cello when I was in high school. I did not, I was not good. I did not do great, but I loved it. It just brought a lot of happiness, even though I wasn't great at it. So it was one of those things that I wasn't that good at it, but I just wanted to learn more because it brought me happiness. And so I minored in music with cello as my instrument. I had to learn how to play piano and sing, and I did not do good with those either, but I still passed all the classes. The trick is that whatever we choose to minor in to be very, to have a resume, our background stand out, we should still either be really good at it or put in hard work into it so that it doesn't affect our GPA, right? Because if we just choose something far-fetched and we are not good at it, or we have no interest in studying it, then it's going to affect our GPA adversely. But thankfully, I worked really hard in all my classes, even though it didn't naturally come to me, but it was so much fun.
Mm-hmm. So, what activities and extracurriculars did you do in college?
In college, I did a lot actually. Like I said, I was trying to explore my different options. So I really wanted to get very involved and active. So I was part of a multicultural program. I was the president of Unite for Sight, which was focused on basically eye care, bringing awareness about eye health. We would go into the community, do screenings, and we also did international work. So I went to India and volunteered in a camp in India. So I was really involved in that. And then I actually created a new organization with my friend called Stop Diabetes. Again, the same concept from high school. I was very passionate about educating others, fighting the childhood obesity, and helping kids like learn healthier choices. Because if kids start making changes, I feel like the parents would actually start making the changes. And it was really amazing. Like we would bring blueberries or blackberries to the kids, and they'd be like, "This is the first time I'm eating this. It actually tastes good." So it was just, oh my God, it touched my heart so much. And we would just go do activities with them, and a lot of campaigning against ingredients that are bad and fast food. I was part of different multicultural groups, like South Asian associations. And that through those, what I did was just explore, my culture and bringing representation for my culture. I love to dance, so I choreographed, and I would participate in different shows. What else did I participate in? So that was the majority of it. There were like 8 or 9 different organizations that I was part of. Yeah. And then what I did was also do research and things like that. So I did a lot of research too on the side.
Mm-hmm. So, what did the pre-med track look like in college, and what was preparing for the MCAT and medical school like in college?
In college, because I majored in biology, I did not have a very hard time getting that to blend in with the pre-med track. I have to say there are some classes that's really probably not going to be for you. Oh my God, I recall with horror organic chemistry. I absolutely hated that class. There were a lot of challenging classes, and then there are other classes that are just like, oh, I love this. It's so interesting, but not everything is going to be like that. Like anatomy and physiology. I loved it. I loved the chemistry classes, but the organic chemistry, cellular biology, biochemistry, we had to take statistics. I did not like any of those classes. But then when it came to like psychology, philosophy, anatomy, physiology, all of those were great. So nothing's going to be, oh, I love all of it. We have to, again, put in that diligent hard work into many of the courses and get past it and get through it. So when I struggled, I actually went and I approached the TA, I approached the professor. I would let them know, hey, none of this makes sense to me. And I didn't do well in the exam. I need extra help. So, and the professors, I went to Loyola, they were very approachable. They would make time for me to sit down with me and help me understand the concepts. What I did was, back then they didn't have all these recorded lectures, right? I'm sure now in college they're recording and putting everything there. So I would have to go with the recorder and sit there all the way at the front. Oh my God, that is just bringing back so many memories. Yeah, but basically I recorded lectures of classes I didn't know and listened to it over and over and over again. But if you want to get to medical school, it's dedication. And you have to know you can get past all of the roadblocks, and it's not going to be easy, but it's ultimately worth it. Yeah.
Mm-hmm.
Oh, the MCAT part. So MCAT for me was really scary because it obviously weighs in a lot for the applications, and I was never good at taking board exams. I always sucked at it. It was just so nerve-wracking for me, and I'm that person who will double, triple, quadruple guess and just pick the wrong answer, and I never was good at that, so it definitely made me very worried. But I took at least a good 6 to 8 months to prepare for it. And I started preparing with material. I talked to my friends who had matched and gotten into medical school, like what kind of resources they used. And I also signed up for the Kaplan program then. And that way I just had at least some structure. And there were all these practice exams that I would regularly take. And closer to it, you dedicate a lot more time to preparing for it very, very diligently, made a lot of note cards. And one thing that I do personally is I actually love nature a lot. So things that are harder concepts for me, I would make a note card set for them, and I'd go for a walk with those note cards where I would just try to not make studying such an arduous, dreadful process. So when I go for a walk outside, I'm learning what I like. And sometimes people listen to certain things too, right? When they go for a walk. So those kind of things only prepare us for all the other boards that are coming up in the future, because there are a lot of exams.
Yeah. So how was medical school? In other words, what did it feel like in terms of rigorous studying, and did you like it?
Oh, I loved it. I wouldn't say that about residency, but if I had to do medical school again, I would, because it was one of the best times of my life. It's just because the friends you make there, the people are just so like you. They're so similar to you. They're coming from different stages in life. I had friends who were parents who had a whole another career before they came into medical school, but it's a very supportive environment actually. So I really enjoyed it. What made it especially helpful was I found that having roommates really helped. So me and my roommates, we would go and study together things that were hard. Like sometimes we had biostatistics again in medical school. I'm like, oh my God, not again. So my roommate was really good at it. And so she would make the time to come and help me through it and study for it. So I would say, you know, as long as you find the right friends, they're going to be your pillar during medical school. It was definitely very like a delirious time sometimes, especially because we have so many exams in medical school. We have almost like weekly exams, you know, certain courses like dermatology, what else, like urology, certain courses like that are only like 2-3 weeks long. So it's a lot of material crammed in. And one thing that I can tell you though is I never pulled an all-nighter. Not in undergrad, not in medical school. I would sleep at least minimum 2 to 3 hours before I go in for an exam. And then after the exam is done, I'll exercise, come home and sleep. And we had a gym, utilize it. And anybody starting medical school will feel a little lost. They will question, oh God, is this for me? I can't do this. This is too hard. But my roommate, again, she just told me one thing, Merlin, what brings you happiness? And I'm like, hey, I like doing yoga and I love dancing. And she's like, well, you find a way to do it then. And so what I did was I actually went to the fitness center and I asked them, hey, can I teach yoga and dance? Like I can actually make a Bollywood dance class that's a fitness class and teach it once a week. And it brought me so much balance in my life. So getting through medical school, you just have to know like who are going to be your close friends, your support, and what are the things that bring you happiness, and try to make space and time for those things.
Mm-hmm. So what did an average day look like in medical school?
On days we don't have an exam, it's basically getting up around 6:30, getting ready. First lecture's usually at 8. So it's a big hall. We all go in, sit with our laptops, and hours and hours of presentation, lunch break in between. And then towards the end of the day, we all would go and work out together because there's always like Zumba or some step class or some class going on. So we would go to that and then come home and study either individually or as a group. We would have days where we would have anatomy lab. We would have days where we would have the OMT, osteopathic manual therapy lab. So on those days, our lectures would be kind of scheduled around that. It was really fun, except for the anatomy and physiology class. Like it can be a little nauseating. The smell of it all, it takes time to get used to that at the beginning. I still remember that. But then, you know, on Fridays, we would always either go out or we would go do some sport together, like play volleyball or play football, something. But on Fridays, no exception. Everybody is either going out or playing some sport. So that's usually what our days look like. When we have exams, it's usually the exams are in the morning and then we usually don't have classes the rest of the day. So we would just exercise or chill. But yeah, on days we have exams too, I remember we had a good time together. We had such good friends. We would all like have some get together after an exam as well. And that really gave us a lot of motivation. But it's just working hard and playing hard. That's really what it was in medical school. And we cooked a lot. We had really healthy habits. Very good. Very healthy habits. Thank God. That's important to find your healthy habits. Because honestly, like pre-med, medical school, all of that is setting foundation for residency and how you're going to be as a physician later on.
Mm-hmm. So what did residency look like and how did it compare to medical school?
Yeah, like I said before, medical school I would do again, but not residency, because residency is everything you've heard of. It is very scary and it is hard. It'll make you cry. I cried my first day of residency. Oh my God. Our seniors, they were really old school, some of them. So after my class came, we brought a lot of resident wellness initiatives. And so it wasn't the same place anymore. But when I was an intern, it was really hard. It was hard to even find time to eat lunch. You are really just shoved into it. And you're a doctor one day, when you were a student the other day, you're now a doctor. And it really is everything's, you feel that pressure. that you don't know many things and your pockets are full and you're like, oh my God, I don't know what I'm doing, but I gotta wing it till I make it or fake it till you make it, right? That was the motto, the first year of residency. And you just learn so much though. The rate, it's exponential how much you learn. Night shifts are terrifying because there's only one person per service for how our residency was, but there are always seniors, so their support, our attendings were amazing. Our attendings were always there to answer anything we had, even in the middle of the night, but you want to sound smart, right? You want to impress them. So that's always the pressure. You don't want to come off looking like you didn't do your homework. But we had a lot of material. We would have access to up-to-date and FP notebooks, so many online resources, and then also books and notebooks. So the joke is, as an intern, your pockets are full, right? And then second year, you're not carrying around as much. And as a third year, all you have is like a stethoscope. So that's how the progression goes. And as a second year, you are empowered a little bit more. You're a little bit more comfortable. You know your colleagues better. You know the attendings. You build a rapport with them. And third year was pretty awesome. You're a senior resident. You're in charge. You're running the codes. You're talking to families. You're supervising the new interns. And I really enjoyed my senior year. I also had the opportunity to make rotations that I wanted. So I put together a integrative medicine rotation. We put together a wellness committee for the residents. I was able to teach yoga, and it was really good. They gave us so much freedom to let the residency become what the residents wanted. And that's really what family medicine is, to be able to live the truth, live a true, genuine life that you want your patients to live. It's not about just saying one thing to the patients and then trying to live a fake life where you're sleep deprived and not eating healthy, you're not sleeping enough, you're not exercising enough, and emotionally and mentally you're not doing well. That's not how our residency eventually became a place that was really healthy and happy. So left it on a good note. The beginning was rough, but it's all worth it at the end.
Mm-hmm. So do you have any additional training in your field/area of expertise?
So I actually went off and did a few extra certifications. One of the things that I did was pelvic floor therapy certification. So I'm a pelvic floor specialist. That really comes in handy when we are dealing with women who are postpartum, and people of all ages, actually, those who have recurrent UTIs, overactive bladder, and I do a lot of pap smears, pelvic exams, right? So during a pap smear, it can be a very uncomfortable experience for a woman. And so I actually walk them through a very special technique to help relax them and identify different pathologies that's probably going on that's making the pap smear uncomfortable for them. And I'm a DO, and as a DO, we do osteopathic manual therapy. So I just did a lot of rotations in that, and I took a cranial course in that. So I utilize osteopathic manual therapy a lot in my practice. So again, somebody coming for a pelvic exam, if they're having so much tightness, you start thinking, oh, what else is going on? There's a patient who fell last Christmas on an ice rink because she wanted to skate for the first time. So she probably has an issue with her tailbone. And so just trying to do a pelvic exam by just pushing in the speculum is not a good idea. So it just enhances your ability to do very good holistic care for the patient. And I also went off and did yoga teacher certification. So I utilize a lot of that for my patients who are dealing with panic attacks, anxiety, depression, and people who have certain other issues. Like, let's say a patient is having constipation. They just have really bad constipation. And I see that they're not breathing right. So if they don't breathe right, their pelvic diaphragm is not being activated well, and their other diaphragm is not being utilized well. I teach them how to do good diaphragmatic breathing, and that really helps to improve the peristalsis. So it just helps bring the connection towards everything that helps our patients ultimately, rather than just prescribing medications after medications and having the patient just go in circles. All of this, I feel, has helped me address the root cause of various problems in a more holistic way. And right now, I'm actually in school for Ayurvedic medicine because I want to become an Ayurvedic practitioner. And for those who are not familiar with Ayurveda, that's the Indian ancient medicine that's been practiced for 5,000 years. And it's still practiced to this day, aside the allopathic medicine in India. So I have many friends who are Ayurvedic practitioners and doctors, Ayurvedic doctors in India. So I'm hoping to learn that field further to enhance the kind of holistic care I'm trying to give my patients.
Mhm. So do you have one last final piece of advice for aspiring doctors and pre-med students?
Well, just really know why you're going into medicine, because this field is changing a lot. One thing that I take on as a mission to help educate aspiring physicians and young medical students is we all go into this to help people. We all go into this to do good and we're passionate about it, but little is told about the reality of it. Insurance companies, corporates, and all of this, they can dishearten you. When you get into residency, you'll get a taste of it, but only really once you start practicing, you know that you have to work within so many confines and you're restricted. So get a practical understanding of what the medical world and healthcare policies, how healthcare is done, and know which field you want to go into where you can truly do for patients what you want to do. But if you're truly passionate about what you want to be, and if that is a physician, always keep that reason close to your heart when you go through the training, because you can get very disillusioned at certain points with insurance companies, all these policies and restrictions, but you will always find a way to keep the purpose true and keep providing good, genuine care if your intention was pure and right. Never go into medicine for the money, never, ever, because you can't function and stay happy as a physician if you do that. You
Mhm.
get what I mean? Yeah.
Okay, thank you so much for letting me interview today. I learned so much. Thank
Oh,
you.
I'm glad. Thank you for this opportunity. You take care.
You too. Thank you.
Bye.
Bye.